Great. So I am at Advanced Medical Imaging, and this is Women's Center. This is the place where I get to wait before I get a mammogram. And I'm just here today to find out more information about what it is, what I should know about breast cancer. Obviously, October is a great time to do that, so I'm really excited to talk with them and see what this is all about. Okay, so I just came in here. It's a nice sized room. It's for me to change, and they gave me a little cape to put over and then a robe so that I'm nice and warm during this entire process, which is awesome. And then they asked me to take off my deodorant, which, go figure, I wasn't planning on doing that, but apparently that's part of the process. And then this is a nice little touch. They put a mitt in here. At least I think it's a mitt. So kind of cool of them to do and make me feel comfortable. So I'm gonna get into my robe and then move into the next room. I'm obviously younger than a lot of women who start getting mammograms, but I really was curious to find out, how do I start educating myself?
Yes. Well, the first thing you want to do is find out if there's any family history. If you're just an avid risk, no family history, asymptomatic, the first thing that you'd ever have a mammogram of is when you're 40. That's when you would start.
Right. Yes. And at age 40, how often do I need to get a mammogram?
American College of Radiology, and what our radiologists go by, starting at 40 every year.
Every year.
Mm-hmm.
I'm going to ask the obvious question that you probably get all the time.
You bet.
Is it going to hurt?
It's going to be uncomfortable.
Okay.
Yes. I don't like to lie to anyone or misconceive anyone. It's going to be uncomfortable.
Yeah.
If it ever gets to a painful, we will stop.
Yeah. So just kind of open line of communication.
Yes.
For me to say, hey, this feels
we have technical features that we look at to make sure we have adequate compression. Obviously, if it hurts you before that, we'll stop, and we just note that in our chart to the doctor. So
but obviously, you know, the pain I'm feeling in here is going to be a little bit less than the pain I'd have to go through if I waited and found out I had something and then was dealing with that for months or years on end.
Yes,
that's the message, right?
Yeah, this is less than 5 minutes of any sort of pain and discomfort.
All right, so it's kind of like working out. So
yes, exactly. If you can get through that, you can get through this. Your right shoulder,
okay.
And we'll keep it off your left.
Okay.
Okay, and then you'll scoot towards me a little bit. This is going to raise up to your level. And then I'll have you turn your head towards me and then lean on in. Your left hand here is going to go up.
Yeah, my heart rate definitely goes up a little bit already. I'm like,
yeah, I'm just taking your
you just get nervous, you know? You're like, this machine, what's it going to feel like?
I'm going to bring your shoulder down.
Okay.
Very good. And then you're going to start feeling the compression. And then breathe. And then it would automatically release you.
Holy moly.
And that's the first picture.
Okay, so it wasn't like, you know, it's not like having a baby, although I haven't done that, but it's definitely like a painful feeling, you know?
Yeah,
so
it's very, you'll step back,
okay. And
then we would do the same thing on the other side.
Okay. How do the next two go? I mean, is
okay.
It,
Yeah, we would stay on your left side.
Okay.
And then we get a side picture.
Does it get a little easier, or same compression feeling? Mm-hmm. So that stays similar.
Yes. So what this one does gets clear up into your armpit, because we like to look at lymph nodes in this picture. So
that makes total sense.
All right.
So it's just a lot of pressure.
A lot of pressure. It is.
Yeah.
Yep.
On an area where you're not used to feeling any pressure at all. I mean, you know,
yes, correct.
It's just very different. Kind of just looking at how that went, I feel like I had more anxiety before because of things I've heard from friends or family members or, you know, Reddit. I mean, Google freak you out, and that wasn't that bad. I mean, yes, it hurt and there was a lot of pressure and it was uncomfortable, but I'd say like Sarah at AMI, she made me feel totally calm and relaxed during the entire process, and that's a big part of it. If you have somebody talking to you, telling you what's going on and making you feel comfortable, it's going to be a lot easier. So would I do it again? Yes. Advanced Medical Imaging is actually giving out flowers in the month of October to people who come in and get mammograms. So pretty cool. I'm gonna go change and then I'll meet you outside. You know, walking away from today, I'm definitely gonna do a little bit more research on my own family history, and I encourage you to do so. And if you have more questions, reach out to your doctor. You know, don't just use Google and expect to find all those answers, because there are people out there who are willing to answer those questions for you.